Welcome to another episode of Medicine Simplified. In this video, we will know about May-Hegglin Anomaly. Please remember this video is made for medical professionals and medical students. May-Hegglin Anomaly is a rare autosomal dominant blood disorder. It belongs to a group of conditions known as MYH9 related disorders. It is caused by mutation in MYH9 gene. MYH9 gene encodes non-muscle myosin heavy chain 2A. It is a protein important for cell shape and movement, especially in platelets and leukocytes. Triad of May-Hegglin anomaly. First one is thrombocytopenia, that is low platelet count, giant platelets, Döhle-like inclusion bodies in leukocytes, which are seen in histopathological slides. Coming to the clinical features, many individuals are asymptomatic or have mild bleeding tendencies like easy bruising, epistaxis, that is nose bleeding, prolonged bleeding after injury or surgery. Some patients may also have associated conditions like which are related to MYH9 syndromes, sensory neural hearing loss, cataracts, renal diseases, and severe bleeding is rare. So there will be no death due to severe bleeding. Coming to the investigations, peripheral blood smear, which shows giant platelets and leukocyte inclusions. Platelet count, which is decreased. Genetic testings may confirm MYH9 mutations. Electron microscopy may reveal abnormal platelet granules and cytoplasmic inclusions. And there should be also bone marrow examination if MYH9 mutation is confirmed. Coming to the management, doesn't require any treatment if condition is mild. Avoid antiplatelet drugs like NSAIDs and aspirin. Platelet transfusion may be given before surgery or in case of severe bleeding, which is rare. Regular renal investigations are required. Hearing aid is required if there is a hearing loss. Regular eye test is required. If you like this video, please like and share this video and subscribe to our channel. Thank you.